Good morning, Becky. So these monoclonal antibody drugs have been available since last fall to treat COVID-19. They're cleared from 3 different companies. Regeneron, which of course was the drug used for President Trump when he got sick with COVID. Eli Lilly, and the newest drug is from Vir with its partner GlaxoSmithKline. Dr. Fauci touting these drugs and their potential benefit, or their real benefit, last week, saying early treatment can reduce hospitalization or death risk from COVID by 70 to 85%. And they're indicated for people who are over 65 or have health conditions that put them at higher risk for severe disease. And really, these drugs have not been used that much until recently. Regeneron telling us that before mid-July, they were shipping about 25,000 doses per week. Now that has gone up 6-fold to more than 150,000 doses per week. Vir says their orders are up 300%. The Department of Health and Human Services giving us new data and saying that the orders that they have seen since July 1st, 3/4 are coming from areas of the country with low vaccination rates. That red area there from Florida accounts for almost half of the courses ordered. Around Texas, about 1/3 of the courses that have been ordered. We caught up with Reverie CEO George Scangos when he was on vacation last week to talk about what he's seeing in the trends.
Antibodies, I think, finally are getting the recognition that they deserve. They really do reduce hospitalization and mortality dramatically. The U.S., which had an oversupply for a while, it has the potential now to have an undersupply, right? Because the usage has increased so dramatically.
And guys, right now, HHS and Regeneron are telling us supply is plentiful. Eli Lilly's drug had actually stopped being used for a while. It was on pause in the U.S. because it didn't work against some of the variants. Now it has been allowed for use in these 22 yellow states where the presence of variants resistant to the drug is less than 5%. HHS FDA says it still works against Delta, guys, but against Beta, Gamma, and Delta Plus, that's where they say it shouldn't be used. Guys?
Meg, I guess the big issue is more doctors are actually prescribing this now, or is it easier because there were problems before you had to go to a hospital, get this done? What's been the big change?
Well, one of the major changes is we're seeing in Florida, for example, Governor Ron DeSantis is setting up all of these monoclonal antibody treatment sites, encouraging folks to come through. You're seeing drive-through sites. You're seeing people waiting, 50 people outside a site in Jacksonville we saw the week before last. It's curious to see that people seem, if they're resistant to getting vaccinated, they will go and get these treatments. We saw some reporting from Gabe Gutierrez at NBC News suggesting that much. Public health officials are saying the best thing people can do to protect themselves is to get vaccinated. But these drugs do work if people don't want to get vaccinated or if they get sick and they need treatment.